Have you ever wondered how changes in Washington could impact your ability to see a doctor or afford prescriptions? Recent healthcare policies are about to shift in ways that could make a big difference for millions of families. Trump's new executive orders are rolling back programs that helped lower costs and expand access to care. Whether you rely on Medicaid, ACA plans, or Medicare, these changes might hit closer to home than you think. So let's take a closer look at what this means and what you can do to prepare. Now let's talk about what's been happening. Within his first days back in office, Trump signed executive orders that reversed several Biden-era healthcare policies. You might have heard about Biden's initiatives to expand Medicaid, lower drug prices, and extend enrollment periods for ACA plans. Those changes help millions of Americans find affordable health care. But Trump's actions are starting to roll these back. For instance, he rescinded an order that encouraged Medicare to test a $2 copay for certain generic drugs. It was just in the testing phase, but imagine what that could have meant for people managing chronic conditions. What does this mean for you? Well, if you're on Medicaid, things could get tricky. During Biden's term, Medicaid expanded to cover meals, housing, and even air conditioners, things designed to address broader health needs. Trump's new directives might scale that back. And remember, Medicaid doesn't just help low-income families. It's a lifeline for children, seniors, and people with disabilities. If cuts are made, fewer people might qualify, and those who do might find fewer benefits available. And let's not forget the Affordable Care Act, or Obamacare. Under Biden, the ACA saw record enrollments, thanks to longer sign-up periods and bigger subsidies to lower premium costs. Trump's orders could mean shorter enrollment windows and tighter eligibility requirements, making it harder for families to get the coverage they need. For some, this might even mean losing insurance altogether. That's a big deal when we're talking about something as essential as healthcare. Speaking of affordability, let's touch on prescription drug costs. Under Biden, there were plans to lower out-of-pocket costs for medications through programs like Medicare's drug price negotiations. Trump's recent actions seem to back away from those efforts. While it's not clear yet if he'll fully dismantle Medicare's negotiating powers, it raises concerns for anyone who relies on medications to stay healthy. Have you ever picked up a prescription and been shocked by the cost? Imagine if prices climbed even higher. Now, I know some of you might be thinking, but how does this impact me personally? Well, even if you're not on Medicaid or buying insurance through the ACA, these changes can still ripple out. When more people go uninsured, hospitals and clinics often pass those unpaid bills onto insured patients. That can mean higher premiums for you, even if you already have coverage through work or a private plan. It's like a hidden tax, and it hits everyone. So, what can you do? First, stay informed. Healthcare policies might seem like they're happening far away in Washington, but they touch every part of our lives. If you're unsure about how these changes could impact you, take a moment to review your current insurance plan. See if there are any deadlines or requirements you need to know about. And if you're worried about losing coverage, reach out to your state's health insurance marketplace. They can help you explore options, even if federal rules change. It's also a good idea to stay connected with community health programs. Many local organizations step up to fill gaps when federal policies fall short. And before we wrap up, let's think about the bigger picture. Healthcare is one of those issues that doesn't just affect individuals. It impacts families, communities, and even the economy. When people can't access affordable care, it's not just their health that suffers. It's their ability to work, to support their families, and to contribute to their communities. That's why these policies matter so much. Thanks for spending some time with me today. I know healthcare can feel overwhelming, but the more we understand, the more prepared we can be. If you found this helpful, let me know in the comments and feel free to share your own experiences. After all, the more we talk about these issues, the better equipped we are to tackle them together. Take care, and I'll see you next time.